A 15-year-old boy comes to the physician for knee pain. The physician is able to produce pain when placing the patient supine, flexing the knee and applying an inward force to the patient's knee while stabilizing his ankle. Pain is not produced with outward force. Which of the following is most likely to also be seen in this patient? Choice A, pain with downward force. Choice B, genu valgus. Choice C, genu varum. Choice D, genu recurvatum. Choice E, crepitus. I'll wait 5 seconds and answer the question. So, as is the case with some USMLE questions, this is basically like a vocabulary test to check if you know what your terms actually mean. So first of all, the diagnosis here should be pretty obvious. I mean, I am producing an inward force on the flexed knee and that causes pain. So he probably has some kind of MCL injury, medial collateral ligament injury. So I want to pick the term that basically means bending my knees inward, essentially. And the correct answer choice here is choice B, genu valgus. It's just a medical term for inward knees or knock knees, as we might call them sometimes. So like I said, it's pretty much just a vocabulary term once you know what's going on here. So let's look at the other answer choices here. Choice A, pain with downward force. So of course, I'm also testing you on some basic anatomy of the ligaments of the knee joint here. This can represent a number of things. If you do a patellar compression test, that can assess for patellofemoral pain syndrome, kind of low yield. Probably more higher yield is the posterior drawer test, where you push the knee backwards, because you use that to assess for a posterior cruciate ligament injury, versus obviously the anterior drawer test, where you pull the knee forward to test the anterior cruciate ligament. Usually occurs in young athletes, they're playing soccer or something and they tried to pivot very quickly, or they jumped and landed in a wrong way and that tears their cruciate ligament. So just be aware of that, of course. Choice C, genu varum. This, of course, is basically the opposite of genu valgus, which is where you have bow-leggedness. This is testing for lateral collateral ligament injury. And obviously you would also see genu varum in like rickets and stuff. Choice D, genu recurvatum. This is pretty rare and you probably wouldn't see it that often. If you have genu recurvatum, which is basically where your knee is hyperextended the whole time, you can imagine that this can lead to injuries of the anterior cruciate ligament. Not really high yield by itself, but more just something you can piece out logically if you understand the ligaments. And finally, choice E, crepitus. And of course, remember that crepitus just means cracking and popping. Now, usually when you hear crepitus on a physical examination, you will be thinking some kind of fracture. So that can be the case here as well. You could have like a femoral condylar fracture that could probably cause crepitus near the knee. And you can also have osteoarthritis. Osteoarthritis also can cause crepitus. None of these would be associated with a valgus stress test, though. So bring it back. I mean, like I said, this is kind of a vocabulary question, essentially. Just remember, genu valgus is inward, knock knees, and genu varum is outward, so your bow-legged appearance. Don't want to get these mixed up, obviously. Hope you found this video helpful. I'll see you in the next one.